For this next session, the final training for the 2024 Widening the Pipeline Fellows, everyone in this room can lay claim to a pretty sobering reality, and that is we have all lived through what's called a 100-year public health event. The past few years, COVID has taught us all probably some of the most painful lessons many of us will learn in our lifetimes, unless something else like this happens soon, God forbid. But as journalists, the opportunities and the challenges that we've had in reporting on the impact of COVID have been very, very, I think, informational and in some ways valuable, because it's taught all of us a lot about the power of voices, the importance of storytelling, following the numbers, following the money. And so there was a lot to learn. Well, with the advent of a new administration, we have to prepare ourselves for some possible changes in policies and the way rules and laws and things related to public health will play out. And so I thought it was important for us to hear from two prominent journalists who have a tremendous amount of expertise in reporting on public health, in reporting on the impact of COVID, so that they can help you go back to your newsrooms and see what might be necessary for you to do in the coming years. So today we're joined by, first, Aneri Pattani. She's a senior correspondent with KFF Health News and reports on a wide range of public health topics, focusing on mental health and substance use disorders. You can read Aneri's full bio on our website at nationalpress.org, where she is an award-winning journalist. Before KFF, she wrote for Spotlight PA, a collaborative newsroom that investigated Pennsylvania state government. And so I personally want to learn more possibly about that experience as well. We're also joined by Alexander Tin. He's a digital reporter for CBS News, covering the Biden administration's public health agencies and their response to infectious disease outbreaks like COVID and Mpox. He was a campaign reporter for CBS News, covering races for the 2020 cycle. Aneri is also, I should say, a Paul Miller Fellow with National Press Foundation. And Alexander joined us for one of our webinars on COVID. So we like to keep things in the family, and we like to get the best journalists available to come and speak with you. So I'd like to thank both of you, Aneri and Alex, for joining us today. And we're going to start with Aneri, and we'll take it from there.
All right. Well, thank you for that introduction. Very kind. I'm going to get up because it's a weird angle, and I want to see you all and see my slides at the same time. But yeah, I'm excited to talk to you today about health and science reporting, a little bit about my journey, and then hopefully leave time for you all to ask questions and see how and if health reporting plays a role in your work. Oops. Okay. So brief intro, I'm a senior correspondent with KFF Health News. I'll talk a little bit more about my outlet and what it does and the unique model. I recently graduated with my master's in public health from Johns Hopkins. My undergrad is in journalism. We'll talk about this, but I didn't quite realize I wanted to do health reporting until I was at the end of my undergrad career and had taken 0 health and science courses, which should be reassuring to you that you don't need that background. I went back to get my MPH because I was interested in it and wanted to know more. And then, as Rachel was saying, my last day in these seats as a Paul Miller Fellow was Friday. So I got my certificate the same way as you all, and I'm very excited for you all to be here. And perhaps most importantly, I love ice cream. So should you, at the end of this conversation, thank you. I feel like I've already won you over, but should you at the end of this conversation run out of health or journalism questions, I will take any and all ice cream recommendations around DC, so think about it. Okay. So this is Northeastern University in Boston. This is where I went to undergrad for journalism. And I went in knowing that I wanted to write and interview and talk to people and learn interesting stuff, but I had no idea which medium or which beat I wanted to do. So Northeastern has what's called a co-op program. Some of you might be familiar with this, where people in every major take 6 months off from school and work full-time in some job. So between co-ops and internships, I basically tried to test out different beats and mediums and figure out what I like or don't like. I'm from Connecticut, so my first internship was at the Hartford Courant, and I did local features. I worked at the Boston Globe as a co-op doing sort of crime and breaking news coverage, the Texas Tribune as politics and policy, and CNBC doing some business reporting. You will see health and science is nowhere on this slide. However, just because it wasn't the main focus of my internships or the outlets that I was working for, doesn't mean it didn't come up. In fact, it comes up all over the place in everything, in every one of these topics. So where I got the most mental health or health reporting that happened to be mental health focused start was at the Texas Tribune. A lot of the policy work, I was interested in the time I was in college. I had a friend who was dealing with a lot of mental health crises. We were having trouble getting them services. This is very common news at the time, but at the time not as much, that the counseling center severely understaffed, didn't have time for people. So when I came to Texas, I was like, hey, I wonder if this is a Boston-only thing or if it's other places. And in Texas, all the largest universities are public universities that are subject to public records requests. So I was able to put in records requests about their staffing and their wait times for students in their counseling center, and able to tell a story about how funding for colleges and where that funding was being funneled largely to sports in Texas, that was causing issues in the types of health services and what that meant for college students on the ground. So this was sort of, even though I was in a politics policy beat, where I kind of started reporting on this. So after graduation, by the time I got to the finish line, was like, okay, I like health reporting, I want to do this. But as I said, I didn't have any health or science sort of official courses under my belt. So it was a lot of learning as I went and trying to figure out any place that would, let me do some health reporting, even if it wasn't my main beat. If I was GA, could I still pitch stories on health and kind of build up those clips and that expertise? So I had a summer internship at the New York Times where I wrote a little bit on global health, but also just did a lot of study stories. Like, hey, this scientific study came out, whether it's in medicine, in physics, in anthropology, in whatever it is. Can I write an interesting story about this new scientific study that's out? I went to WNYC, which is the NPR outlet in New York, learned some radio skills, which was a lot of fun, and did more like local health reporting. Like, hey, there's lead in the city's public schools. There's lead in the walls of the paint on public housing, and what is the impact that has on children? I went to the Philadelphia Inquirer, which is, again, a big college town, so I went back to college mental health reporting. That's where my interest in a lot of health reporting started. And then as I did that, it kind of broadened. Like, hey, I was doing mental health stuff. People would see my stuff and be like, have you written about postpartum depression? I was like, no, let me look into that, and kind of widen from there. And then I was at Spotlight PA, which is the statewide investigative outlet in Pennsylvania, when COVID hit. And so it was a lot of coverage of how state health departments were responding to COVID. And at the same time, with COVID, we saw increases in addiction and overdoses. So I did a look at how the state government was overseeing addiction treatment facilities, or not overseeing them. So now I'm at KFF Health News. We're a little bit of a unique outlet in that we only cover U.S. healthcare and health policy. So we're not, covering sports or crime or courts like a general news site. We also are a nonprofit. We publish every article on our website for free, but we also allow other news outlets to republish our content for free. So AP but free kind of thing. And so that means a lot of times our content appears in smaller newsrooms, newspapers across the country that don't have their own health reporting staff, or larger national outlets as well, including Alex's. Sometimes we're on CBS News on his site. I here generally cover addiction, mental health, suicide prevention. Really cheery, I know. But basically anything with a public health tie-in is under my purview. And as you'll see from some of the clips I share, I think public health is really broad and can be whatever you want it to be. And some of that comes from my background of covering health when that was not my beat. So I will walk through quickly a few examples. So this first story here comes from when I was at Spotlight, PA. It has to do with the Harrisburg Area Community College, which is a community college system across central Pennsylvania. And we had gotten a tip that they were cutting their counseling department without telling their students. So I was able to get a memo that confirmed that, and then do a series of stories about, students learning about it, they're protesting about it, a particular, an individual student who was impacted, and really saw the students there mobilize and take more action. And as a result, the college partially reversed its policy and reinstituted some counselors and hired an outside firm. And again, running theme, college mental health is where I started. It's the thing that kind of always brings it back for me. In the middle here is a story from the Philadelphia Inquirer, where when I say public health is kind of broad, gun violence, also public health issue. And so as a health reporter, I tried to, in Philly, there's a lot of coverage of gun violence in different ways. What we tried to do was look at what do the people in hospitals who see this constantly in Philly, what is their experience? And not just the trauma surgeon, but the person who works in the blood bank of the hospital and runs it from floor to floor, the chaplain who visits with the families afterwards. And so we kind of told that story through 6 different perspectives. And then the far one is, I mentioned I had looked into postpartum depression. And there was an interesting statistic that, women of color were seeking treatment a lot less often than their white counterparts for postpartum depression. And so I set out to write about it. My thought was probably, it's expensive, or, out of insurance networks, or just far away to get to. What I ended up hearing from a lot of moms is well, when we go to seek mental health treatment, there's a fear that child services will get involved, and child services has a history of, racial biases, and so basically all these moms were we're terrified of having our kids taken away. We can't seek mental health care for that reason. So this was a really interesting example to me of kind of how I thought I knew the story and I really didn't. And when you do health reporting, it extends into all different kind of agencies and fears and things to learn about. These two are from my work at KFF Health News. So this one has to do with, in 2021, post-COVID, people were really worried that suicide rates would have gone up because everyone was so isolated and there was so much economic uncertainty. In 2021, the CDC came out and said, actually, suicide rates have dipped for the first time, and everyone was super jazzed, it's good news. But when you disaggregate the data by race, it's a very different story. Suicide rates went down for white Americans. They went up for Black Americans, and in some cases, Asian and Hispanic Americans as well. So I ended up doing a story looking at hey, the data's more nuanced, but also what does that tell us about what the response needs to be? Because clearly some interventions are working for suicide, but not across all populations. So how do those responses need to be different? And on the far side is one of the first stories in what has now been a 2-year series I've been working on about opioid settlement money. So all the big pharmaceutical companies that sort of misleadingly advertise their painkillers as non-addictive got sued by states and counties and are paying out billions of dollars that the state and local governments are supposed to turn around and use to provide better mental health and addiction services. And basically my series has been tracking that money and seeing, are they using it for those purposes, and who's in charge of it, and how does it get sorted out. And if anyone wants to talk to me afterwards, I think this is a great story to localize, and I have a lot of databases and tools to help local reporters do that, so happy to work with you if that's something of interest. Okay, so quickly, tips for you all. So in case I have not driven this home, health story ideas are everywhere, and they don't have to come from being a health reporter. They can come from your family and friends. Like I said, that's how I got interested in college mental health, but also my mom will sometimes be like, oh, I was trying to see this doctor, but I had to do 30 different things to get insurance to clear it. Those can all be story ideas, draw from your life. You don't have to be a health reporter to cover health. Mental health shows up in education. This shows up in crime and courts reporting. It shows up in politics. So there's lots of roads into this. I think it's really helpful to break down the system into small pieces. When you try to do a story about like hospital billing and how if you take on the whole hospital billing system, it's overwhelming and it feels like, how am I supposed to understand this? Like, I'm not an insurance agent, I'm not a billing agent. Instead, try to do a story that's like, one patient had this one bill and we try to sort out why it's so crazy. Boil things down and start small, because otherwise the system can feel overwhelming. So it's a good way in. It's also a more impactful way for the readers often to hear the story from like one person or one snapshot. Which ties into, don't be intimidated. Health and science, like, yeah, there's a lot of jargon, there's wonky stuff to it, but as I said, I did not have this background, and you can learn it on the job, and there's tons of resources out there. The Open Notebook, the Association of Healthcare Journalists, et cetera, can teach you how to read a scientific study, teach you what questions to ask people, where to look for experts, et cetera, et cetera. Don't be scared to ask dumb questions. Like, our job is to ask those before we do the reporting, because we are a stand-in for people who don't know, for readers who don't know, health and science stuff. It's also so that we don't get things wrong. So I tend to ask experts, researchers, scientists, even individuals, what do other people often get wrong? What are you worried about being misunderstood? They'll tell you. They'll generally tell you, especially if they've had a negative experience with the reporter in the past, and it helps build trust as well, that they know you're asking these questions. That being said, everyone makes mistakes. It happens. I've had corrections. You've either had them or will have them. I will have more. It really sucks in the moment, and it feels like, especially I think as younger reporters, feels like no one's going to trust me again. This is going to make it hard to move forward. It's not. It's really not. Like, you learn from them, but I think there isn't an understanding in the journalism world that like this happens to all of us. Do your best to learn from it, forgive yourself, and move on. And then next time, like, oh, I didn't ask this sort of question, I should always ask this next. And then lastly, the thing that I love about health the most, and Alex and I were actually talking about this out there, is that it's really human. So yes, like I write about policies proposed in Congress, or the CDC is doing this. But the reason it matters, and the reason people care about it, and the reason I care about it, honestly, is because it affects everyone at home, right? When I write about mental health, I know someone. When I write about reproductive health, when I write about lead in water, when I write about gun violence, it's because it impacts a real person somewhere. And so my pitch for health stories are always to try to bring it back to that level. Like, yeah, there's this, state legislature is debating whatever, but who is the person who's going to be impacted by that? And that's how you get people to connect with your stories. So that is it, and I will happily take questions on any of the serious topics and/or ice cream flavor, the most serious of all. So, thank you all.
Alex?
Thank you. I'm also a big ice cream fan, but most of what I eat is like the Haagen-Dazs bar from Costco. So anyway, I'm sorry if you've ever tried it before. So I guess while they're pulling up the slide deck, the one thing I forgot to mention to Rachel is my bio has changed slightly, which is it used to be covering the Biden administration, but now I'm also covering the incoming Trump administration. I used to be a campaign reporter in 2020 for CBS. I was based in Nevada and then Arizona. And then now I cover public health agencies. So FDA, CDC, CMS, SAMHSA, if they are a federal government agency that is supposed to cover health, I cover that intersection. And it bleeds a little bit into some of the other departments. So like with the H5N1 and raw milk situation, I've also been doing a lot with APHIS at USDA, for example. So anyway, what I do on a day-to-day basis is a mix of answering requests from our TV shows and radio. So I don't typically go on air, but the producer who is working with the talent who is going on air will reach out to me and say, hey, do we have this from CDC? Do we have this confirmed? Can you tell me more about this? And I'll try to give them some context or say, wait, don't say that. You're supposed to say this instead. And then in addition to that, I also write articles for our website. So I just went back and I took a handful of articles that I liked when I was working at CBS over the past few number of years. And I tried to pick ones that had to do with one of these kind of like tips that I know not everyone here is a health reporter. As Aneri said, you don't have to be a health reporter to report on health, but hopefully these tips have something for everyone. And I apologize if they're redundant, but I'll just walk through them. So the first thing is to watch for frequently asked questions on your beat. I mean, this seems like a dumb thing, but I have to remind myself constantly of this. If you are covering something a lot, and this is something, at this time, I was covering a lot. We were like just coming out of like that first big wave of COVID, and everyone kept asking, like at every single event that I watched with like Walensky and Fauci and Ja, like, oh, why are you doing this? Why are you doing that? How are you thinking about this? And the question kept coming up again and again and again of why are you wearing a mask right now? And when I Googled it, I realized nobody had answered that question of why are Biden officials wearing a mask, but they kept getting asked about it. And then so I talked to my editors, that turned into this story. And I'm also mentioning this because I have a trip coming up next week, which is why I decided to wear a mask when I went back and looked at this story and thought, oh, I don't want to get sick before my trip. So anyway. Another one is to bookmark milestones to come. Again, this seems obvious, but I have to remind myself of this all the time. This specific story was, I don't remember the exact year it happened, but the CDC started measuring in people's blood, like how many people had antibodies from surviving COVID. And it was inching up. Like every quarter they would release this data. Nobody was paying much attention to it because it was like these random weird numbers nobody cared about. But the second that data started getting released and updated, I made a note to myself that here are the milestones coming up, that once we cross this threshold, it might be a story. And I started laying the groundwork with my editor of like, hey, however many months from now, this might be a story. Tell me if you're interested. And started kind of building that foundation. That turned into this story that got a lot of pickup at the time. Another tip is to look for experts with skin in the game. This happens a lot with health, but if you're like a health beat reporter, but it happens in all the beats. You'll get pitched a million times with experts and people who like get quoted everywhere saying like the right thing, but they don't actually have skin in the game on covering that topic. So what I try to do, I don't always have time to do it, but what I try to do is quote experts who have actually published research about it. And you can do this pretty easily. There's a government website called PubMed. There's a bunch of other ones too, or you can just Google it. But you can look for people who have actually done research, who have seen patients and have looked at the trends and are thinking about it. And that has made, I think, a lot of our stories a lot better. You guys probably don't remember this, but there was this big trending uptick at parechovirus at a time. Everyone was writing about it. But we had a really great quote in our headline that got a lot of pickup for our story because we went and actually found somebody who had been tracking this, who had published research about it. And it made our story a lot better, and I think it made it a lot more interesting, and it also got a lot more clicks. Another thing that's related to that, of what I mentioned earlier, is make a habit of planting seeds. This is something right when I was getting into journalism, a mentor of mine when I was interning at a different part of CBS always told me, which is there's the breaking news story that you're covering in the moment, and then everyone's going to move on to something else. But don't forget that if it was interesting now, a couple months when nobody else is paying attention to it, it could be interesting again. And so what I try to do, and again, I don't always have time to do it, but what I try to do is always set aside time routinely to think back on the week and think, okay, these were the big stories in my beat, in my newsroom that were related to me. What are things that I can do now that might create a story down the road? Often for me, that's like FOIA requests, but it can be any kind of thing, That is actually what led to us putting a FOIA request for the records on the Boar's Head plant, which, if you guys were following the news, it turned out they had all of these long record of violations. And we were the first outlet to report on it, soon followed by the New York Times, which did not attribute it to us, but that's fine. The AP did. And it came from the fact that at the end of that week, after we had been reporting on kind of the day of news about Boar's Head, thinking okay, how can we move this story forward a month from now? And that's what led to this request. Related to that is asking people who have worked in the field if the narrative about the stories that you're telling is right. And the reason is because, and this is one example, but it happens a lot. After the Boar's Head story, there were a lot of people who were saying like, oh, you know, it's all on Trump. Trump cut the inspections. Trump cut the funding. You know, that Trump guy, you got to vote against him because he's going to cause another Boar's Head. I used that narrative, which had a lot of people were talking about, and it is true if you want to get into the weeds on it, he did cut back on inspections. Did he really cut back on the funding? That's a more complicated question. But I went and I talked to people, current and former people who had worked at APHIS, and said like, hey, have you seen these tweets? You know, have you seen these claims? Do you think they're right? Like, what am I missing here? And 50% chance it would be interesting if somebody said like, no, they're totally right, and I was super frustrated with it. But actually, when I started reaching out to current and former people, they said, you know, not exactly, but there is this other thing that we've been super frustrated about recently that you should cover, which was, at the time, the Biden administration was also cutting back on listeria testing, which was a thing that nobody had covered, but everyone in food safety world was super frustrated with. And so as a result of that, we were able to publish this story, which also did pretty well on our website. And then the last thing is, I think this is the last thing, there might be one more, is don't settle for yesterday's news. If any of you have worked in that type of newsroom, which unfortunately I do, you often get assigned something which is like, hey, this thing is trending, or our competitor is covering this, can we also get a story on this, right? Which, it is what it is. It's the nature of the business. Sometimes you don't have time to like do something original with it. But whenever I can, I always try to remind myself, there is a way that you can move the story forward, even in small ways. And often those stories will do better than if you just rewrite the story somebody else did. And so here's an example of something I did recently. We'd been covering whooping cough for a while. And I got a call from my editor saying, or a Slack from my editor saying like, hey, whooping cough is trending again. Can you like do another story on whooping cough? I heard the news figures are coming out. And I was like, another story on whooping cough. How many times am I going to write the same story? But one of the things that we did is we went back and we looked at the numbers and we saw that it was setting a record in a new way. And we also used it as an excuse to actually go and specifically talk to the officials in one county in Ohio, which has been seeing the highest number of whooping cough cases this year, and essentially ask them, why do you think the numbers have been so high? And it ended up turning into a really interesting story that got a lot of pickup on our website. So anyway, those are just some examples. There's a lot more that I'm covering. As I mentioned, I'm also covering the incoming RFK Jr. / Trump administration. Happy to answer any questions. And here's how you can contact me or find me. So thank you.
Why don't you both have a seat? So one of our speakers this morning, Lori Montenegro, she's the bureau chief for Telemundo, but she talked about the fact that the impact of what's been happening over the past year during the political season, and then thinking ahead to what we will have to consider covering a new administration, can take a toll. And another thing that can happen is we almost have to guard against the impulse to approach it with, oh my God, we're all in trouble, you know, with RFK and whatever. As journalists, we clearly have to sort of do a measured response and just cover the facts. But there's some tension, particularly from her perspective, people who cover immigration, for example. You almost have to gird yourself for that. So I wanted to have both of you talk about that potential effect in the work that you're doing. Let's start with you, Alex.
Yeah, I mean, mine's a little bit interesting because I feel like actually, in some ways, the interest in at least health work on my beat has never been higher. You know, it's funny, one of the examples was there was a story that I had been pitching on food additives for like forever. You talk to any FDA official, current, former, they're always saying, oh, there's this food additive thing, this blah, blah, blah. it was never getting interest from my editors. And then, of course, with the election, Bobby Kennedy has made a big deal on how he wants to like reform and change the way that U.S. regulates food additives. Interest has gone up. So I wouldn't say that it has been as much of a challenge on that aspect, as well as it has been an opportunity to like really take the stories and the experience that I've built on like covering this beat and actually using it to like add something to the conversation. So, you know, I don't know. That's a long way of saying that I'm actually looking forward to the opportunity to like hopefully tell good, interesting, nuanced stories. And I'm glad there's interest in it.
That's a word I've been trying to use with many of the journalists is swap out opportunity for challenge, or, you know, and it's easy to say that. But Aneri, what are your thoughts about this?
So I think partly what Alex says is it ties in exactly to what I was thinking, in that though there are really large personalities coming up in the new Trump administration, which was true in the last one too, but some different ones. I think what you see this time is there's like the actual policies that they are wanting or promoting kind of run the gamut from like conservative to liberal, right? You have Bernie out there agreeing with RFK. So like it's one thing to look at like the personalities and the press conferences and cover that, and you know, we have to some degree as a journalism world. But I think there's also an opportunity to look at what are they actually proposing as the policy and what are the merits or the drawbacks to those actual policies, regardless of who it's coming from. Because I think sometimes there's a reflexive reaction of like, this person has X, Y, and Z policy that is totally unfounded in science and anti-science, but they also have this. And I think it's hard, but kind of hopefully we as an industry can do both. Like, let's fact check this and hold them accountable for this, but also engage on this policy. And I think that helps us as reporters and our audiences deal with some of the fatigue and hopelessness that can come from reporting that is only in this, like, hey, this is terrible and, you know, nothing is based in science. We can also do this and give people and ourselves a little bit of hope.
Let's take some questions. Oh, where's the mic? Oh, yeah. I'm going to enlist all of your help in passing the mic around, so.
Hi, guys. My name is Aditi. I work for CNN. I kind of want a more retrospective perspective from you guys. When you guys were covering, you know, the 2020 COVID, you know, new information's coming out, all of that, and there was a lot of misinformation, disinformation flying around. Just from a journalism perspective, what do you make of the work that was done at the time in terms of like fact checks or like, hey, maybe don't take bleach, or like, you know, I forget the other medicine, like ivermectin, was it?
Yeah.
So things like that. Like, do you think that, you know, if you had to go back and do the stories, would you do it the same way? Or is there like, after having some years, you know, since that time, would you approach it differently? And I kind of mean it in a, you know, news readership, audience interest, that kind of way.
Well, I would say, I mean, it's COVID or not. I mean, every single story I have written or done, I can, every time I like, even these ones that I highlighted, I like 50% of it is like, oh, what a great job I did. And then 50% of it is like, oh my God, I would have done that totally different now if I could have done that again. So with that caveat of like, this is not unique to COVID. It's like every story that I have ever worked on, I have regrets. But I will say that I think there is a lot that I think with the retrospective we have now, we would probably do differently. But it's also easy to say that, I think, as somebody who is not like in the heat of the moment. Like, I remember how like we were working these like super long hours, things were breaking in the middle of the night, preprints were dropping at like 5 a.m. that everyone was covering. It was like, it was crazy. So I don't know if there's like a specific thing, like a big picture, like if I had gone back, then I would do this one big thing differently. But yes, there's definitely lots of like small things I would have done differently. But again, that's with every story, not just with COVID, I think.
Is there anything that comes to mind?
Well, I mean, this is a very small thing, but there was this one thing with how the CDC was counting COVID deaths at the time. And I remember everyone was like, competing is maybe the wrong word, but all the outlets were like trying to report as the COVID deaths were going up on how they were going up. And like, oh, we just hit blah, blah, blah thousand. We just hit blah, blah, blah thousand. The New York Times just did that like big cover story on like all the faces of everyone who died from COVID. Those stories were important, but at the same time, I do think it probably consumed at least more of my time than I wish it had, as opposed to like finding all these unique ways just to like count how the numbers were going up. I think that used up a lot of time we could have spent reporting on other things. But again, it's easy to say that in retrospective because at the time, we had no idea. So anyway, that's just one thing that comes to mind.
I think, sorry, can I weigh in on that quickly? Just that I do think there is stuff that I wish had been different, but I don't know that even now I know how to do it differently. And the main thing I'm thinking of is trying to reach different audiences, right? Like I wrote a bunch of fact checks, I wrote explainers, what is herd immunity, how does a vaccine work, what do we know about ivermectin, et cetera, et cetera. But I don't know that it got to people who didn't already think that. And I wish I had done that differently, but if you ask me now how to make sure I effectively reach those people, I still don't know. So I think there's a lot of experimentation happening, and some of that is exciting and interesting, but I haven't talked to anyone who's fully like solved that problem of like, how do we get it to the people who could benefit from it most?
I have a question about how are you guys both approaching this transition to the next administration? Like, what kinds of calls are you making? Who are you calling? Like, how do you prepare yourself to make sure that you are able to be in the room when things happen, especially since it seems like health is going to be a major part of this? I'm in education, so it'll also be a major part of mine too, right? So, yeah, how are you approaching covering these departments with new people in them?
I will go very quickly because I think Alex will have a better answer for this. So my role is not super politics focused, right? Like I'm looking to see how and when it makes sense to cover, but also because my outlet publishes with other partners, we try to do stories that they're not already doing or don't have the resources to do. That being said, I did just have a meeting this morning with one of my mentors to talk about this and how to source and things like that. And we talked about, putting in a FOIA request for who is, like in February, who is the new hires and departures, who left each agency or thing that you're interested in. And looking up former people on LinkedIn who formerly worked in this administration, what insight can they provide, asking for those coffees with the comms people for whichever agency you're interested in, even if they're outgoing, or maybe especially if they're outgoing, like what they're worried about or what they're interested in. And shout out to Tanya Riley, my mentor through the Paul Miller Fellowship, for a lot of those tips. So.
Yeah, I think I have the benefit and the curse of Bobby Kennedy being both a very public figure with a lot of very public supporters in his orbit. So it's the first thing that I did was I tried to reach out to essentially everyone I knew had been quoted or mentioned or, some kind of connection, and just saying like, hey, like we should talk, we should chat, you should tell me about like why you supported him and like what you're hoping will come. The other thing that has happened a lot already, and if you've been following this at all, is that there is already some like internal schisms within the so-called Make America Healthy Again movement, which, you have the one side, which is a lot of the like, they would call themselves the health freedom people on like things like vaccines and supplements and whatever. And then on the other end, you have a lot of people who came into the movement through like food additives and concern about pesticides. And there is this bridging between these two worlds that created the movement. And it's essentially, that's been a good opportunity for me to reach out to people and tell me like, why are you frustrated? Like, tell me, what do you think about this new pick for Surgeon General? What do you think about this new pick for blah, blah, blah? So that's been kind of the way I've been trying to approach it. And then in terms of actually finding like ways to contact them, Twitter, LinkedIn, often just Googling like blah, blah, blah name, Gmail, blah, blah, blah name, cell phone. Sometimes that helps. CBS does have a service we pay for called Nexus, which is okay. It's not great. Sometimes it does the job. So anyway, that's just some of the ideas.
So fortunately / unfortunately, what you just said was very close to the question I was going to ask. But I guess, I'm sorry. I apologize. Bradford Davis. I'm a editorial board member of the Fort Worth Star Telegram. But when a few years ago, I did a bunch of stories on public health, actually in sports, and particularly like the apparent rush to bring pro sports and organized sports and back into the fold, despite all of the health questions and risks inherent to having a bunch of men or women in a really close space, sweating on each other and breathing and stuff, and without a vaccine, of course, at that time. This is fall 2020, and one of the things that, again, as I think about stuff I wish I did, I wish I had developed better sourcing among public health workers. But one of the things that I have spoken to, and I actually fortunate that my former neighbor in my building is a guy named Craig Spencer, who you may be familiar with, but he is the semi-patient zero for Ebola, about 10, 12 years ago in Harlem. And he, he lives literally him and his family lived literally downstairs from me.
Has he heard anything about the outbreak in the Democratic Republic of the Congo?
Right, exactly, yeah. So that's my buddy, and we still talk a little bit. But and one of the things that, he and other people told me is that people who currently work in government, public health, tend to be very scared to talk to the media, in part due to all of the ways that, basically their jobs are heavily defined by the executive, by whatever the executive branch in their county or state is, or municipality, in their decisions, and so so even off record, it's I find it to be pretty tough to find. And so I was just curious, again, if you had any specific sort of suggestions about, I guess, the realm of people who work in government public health, and and ways, things that you have found effective as far as finding those people, and of course letting them know that you are a safe person with which to talk off record, or perhaps whistleblow something if something happens.
Yeah, I think I hear you on the fear growing among government officials at all levels. I think offering on background or off the record initially is a good place to start if you have the time to do that. I think so much of this is relationship building, right? The same way when hundreds of people are pitching us experts or stories, we don't open most of those emails, if you're like me at least, except for the ones that oh, I have a relationship with this person and I know. So that's one thing. I think being up to speed on how you can protect your sources, so know what you're going to use. Are you going to use Signal? Are you going to use Proton Mail? And proactively telling them hey, I want to reach out to you here, or we should switch to this platform because I want to protect you. It signals to them that you've put thought into how they're at risk and how you can protect them. Go through comms people. It sucks and the gatekeeping's annoying, but go through them to connect with the person, so the person, for the first time you talk to them, feels comfortable. And then at the end, ask if you can the thing I always ask, and it's a genuine ask, is hey, when I write my draft, I generally circle back to fact check with anyone who is quoted in it. Can I get your email or cell? Because generally I'm looking for a really quick turnaround on a confirming those quotes or facts. And then sometimes the comms person jumps in and is no, you can send it through me. But sometimes you get lucky and the person just gives you their email or their cell, and you can use it for fact checking, which builds trust, and then you have it for the future. So a few thoughts from me.
That is a really interesting tip that I had not thought of. Wow. I should write that down. No, I think the one tip that I would have is that, and I recognize that I have the luxury that not a lot of reporters have, in which I have some free time, but a lot of the health, if you are talking to somebody who's working in public health, most of them have at some point in their career presented or attended a conference or an advisory committee meeting. So at the federal agencies, a lot of them have 1 million advisory committees for all kinds of things: lead prevention, preparing for disasters, tuberculosis, you name it. And then they also go to a bunch of conferences on all these various topics. So as much as I can, I try to go whenever possible in person, or at least attend virtually, and just try to be at all of these places. And you often find when you go there, there's no comms person there. It's just a bunch of random people from the health department talking about this tuberculosis outbreak that they responded to 3 years ago. That outbreak is not going to make news now, but you can talk to them and ask them oh, that's really interesting, blah, blah, blah. And there are some really good sources that I've developed as a result of just being present and being interested and, just attending as much as I could. So that's my tip.
Take one more question from the floor, but I want to jump in quickly with a question about equity and access, particularly when it pertains to the topic of public health. And I think, personally, my suspicion is that is going to be a major issue in the next 4 years. And there's been so much pushback against equity and DEI and everything that is happening. And so often issues like, obesity and even mental health can be sort of siloed and, between the haves and the have-nots and the people who have resources, et cetera. So what are your thoughts for the journalists moving forward about equity in public health as a beat that they could possibly pursue, or topics that would yield some interesting stories? Start with you, Aneri.
Sure. So I was actually having a conversation with a source about this like a week or two ago, where he was like, my title might be changing because there's something about like diversity or equity in his title. I can't even remember the exact title right now. But basically his organization is talking about changing the titles and the language with which they put reports out and stuff like that. Because there is this concern that, it's not going to get funded, or it's actually going to actively lead to backlash. But I think, to me, one of the takeaways was like, they're changing the words, they still want to do the same work. So just because there is this fear and people may not be saying diversity and equity does not mean that like the same sources who cared about that yesterday still care about it tomorrow. They're going to be more careful about how they talk about it perhaps, but it's happening. So my tip would be, if like you're interested in that, which I think you should, there's huge like that suicide disparity story I talked about. Like when data comes out, it's really important in our country to ask like, who is this representing, and what are the different stories underneath. I think do that by looking for sources now maybe who have those titles or whatever in your community, or don't have the title but are speaking out on this issue, and then following up with them afterwards. Even if they're not being as vocal, they're still going to care about it. They maybe just can't like broadcast it on Twitter or Blue Sky or whatever.
You have any thoughts?
Yeah, I mean, the one thing that I thought was really interesting in what Aneri said was that, often, and we were just talking outside about how the opioid deaths, if you've been following the news, it recently started declining after this big surge that really accelerated during COVID. And it's really interesting how often the headline or the main figure, when you tease that apart, that trend isn't always the same depending on the group that you're looking at. I was just thinking about, there was a story that we did last week on anemia, and like there's like a couple different angles you could look at it, but one of the big things was that actually, there's this huge disparity in anemia rates when you look at black women and girls compared to white women and girls, and in how that has affected that kind of top line numbers. So I don't know. I do think that, I think there's a lot of stories there, and I think hopefully we continue to cover them, and even if people aren't using that word, I think Aneri's totally right, that like the people who cared about it last year will care about it today, even if they're just using a different label for it. So,
are there any more questions? Take one more.
Hi, my name's Lily. I'm a photojournalist at the Des Moines Register. When you are like writing about something specific and you found like, or I guess let me backtrack a little bit. When you are writing about something specific, do you usually like find your like human source, like the person who is affected by the thing that you're writing about, and then you go back for the numbers later, or do you like, is there like a certain order you try to like do it in? Some of us are like, I don't write for the most part, so but there are like things like that I'm interested in like doing stories about, and so for me it's a lot easier to find like a human person who's affected by the thing rather than anything that involves numbers. So how do you do that?
I mean, for me, it is mainly numbers to person. So it's like often, for example, CDC puts out every Thursday, and often when you see headlines on Thursday that are related to health, there's like a pretty good chance it's because the CDC just mentioned it in their MMWR. But In that Thursday report, often there will be these big headline numbers, and then it'll be up to me to like find a specific person to talk to kind of illustrate that number. So that's typically the workflow for me. It's very rare the other way around. It probably should be more the other way around, but I mean that's the job that I work in. So.
Mine is both, definitely both. Like very haphazard, stories come in different ways. Sometimes it's exactly what Alex said, like, oh, I found an interesting statistic, the postpartum depression one, right? I read some medical study that found women of color with postpartum depression are getting treatment X amount less than white women. And I was then interested and went through like advocacy groups that work with low-income moms or moms of color, mental health for mothers, and found the person that way. But also a lot of times I hear like emails or tips or just reaction to a particular story from people who are like, hey, this is great, I'm so glad you covered it, here's sharing my personal story, or you did a terrible job, you didn't even acknowledge XYZ issue. And it's like, well, I don't appreciate you yelling at me, but you have a fair point, and that's an interesting story idea. Yeah. So like, maybe let me, depends on how they're reaching out. But if it's someone with, who's disagreeing but respectful or has something legitimate, maybe I will have a conversation with them and then see, like, once I understand their story, is there data that suggests this is a wider spread problem or this is a unique problem, or is there some way I can kind of back up this anecdote to build out a full story? So definitely both.
Lily, I would encourage you to, as a photojournalist, to consider a strategy of, if you are in your reading come across a study that's interesting, and the numbers, it's all, 47% of kids do blah, blah, blah. Go to your Facebook pages or discussion groups and find out if there's somebody in your community who is dealing with that issue. Go to them, say, I'd like to do a photo story. I'd like to find out how your life is with dealing with this situation. It's a way for you to build your multimedia chops and for you to maybe get in the practice of doing this more often in your field. But I think the bottom line out of this discussion for me comes from the concept of opportunity. It would be very easy to think, oh my God, we're all in trouble, as I said earlier. But I think there's going to be an opportunity for journalists to really boost their storytelling skills, to really raise their game in terms of reporting on consequences, impact. What's the real story? Not even just basic disinformation, but just what's really going on in these communities. And I think we've had two very, very good examples here of people who are on the front lines, but who are really doing a measured, thoughtful approach to covering public health. So I'd like to take this opportunity to thank both Alex Ten and Aneri Pattani for joining us today.